Good morning and welcome to Heart-to-Heart, a program which aims to help you understand and to become your loving self. It's Friday.
It's Friday, yes.
I'm Dr. Mitra Rashidian. I'm a licensed marriage and family therapist and a certified sexologist, offering you today's program at KMET 1490 ABC News Radio, along with my wonderful friend, best friend, wonderful colleague, best colleague that you can ever have, Dr. Robert Jaffe.
Thank you so much for such a great introduction.
My pleasure. It's true.
Oh, thanks. I'm.
Well, we've been working together for how long? 16 years.
Yeah, more than a few days.
More than.
I'm Dr. Robert Jaffe. I am licensed marriage and family therapist, licensed since 1984, and I am also a certified hypnotherapist. I'm here today to share with you some of what we've learned over many years of study and practice, on the goal of which is to feel more loving and more joyful every day of our lives, which we can do. It has to do with our attitude. We need to develop an attitude of gratitude.
Exactly.
And when we are grateful, we are connected with the one and only God, which is also us. We are also droplets of God, I believe. And so we want to let you know that we always dedicate this program to you, our listeners. Without you, we would not be able to do a program, and we would be out of work.
Exactly.
Yeah. So we want to tell you that you have been born into this world as your loving, authentic, true selves. We come in with many qualities, several of which are, when we are born, we come in open. Excuse me. We come in curious. We come in honest. We don't know how to lie when we come in here. We learn that. We come in, we're all sexual beings, to create, excuse me, to co-create with others. And we come in trusting that the world is going to take care of us.
Exactly.
We also have the capacity to be emotionally connected with others. We have the capacity to be confident, and we have the capacity to be calm and confident.
Yes.
Yes.
Confident, curious, loving. And, people may wonder, we're having all these qualities. So what happens along the way that we become who we become? And some of us, they just are not able to enjoy life to its fullest, or to even to a fracture of it.
Mm-hmm.
So we're going to touch some of that today. And I'd like to invite you to please call us at 951-922-3532. This program belongs to you, and we would like to hear from you, to share. We want you to ask us questions, share your ideas, what you think overall about what we are presenting to you here. Without you, this show is not going to be possible. Therefore, we have an offer for you. So as a token of our appreciation for you to give us your hour on Thursdays and on Fridays, and we know that's too much of your time, and we value that. So we would like to offer you a free 15-minute consultation to our fourth caller. So if you're our fourth caller today, you're going to get 15-minute free consultation with either myself or with Dr. Jaffe on any topic that you want to talk about related to psychotherapy and relationship. Right.
Yes, and we're not going to do this on air. We're going to do this privately. You won't have to give out, if you call, you won't have to give out your name or any information on the air.
Right.
We will take your call and answer your comment or question, and then offline we will get your information and set up a time, and then you will have access to us, and we will do our best to help you in whatever arena you need.
Exactly. So 951-922-3532. So Dr. Robert,
Yes.
codependency,
Well,
addictions,
addictions and codependency.
trauma,
And
relationship.
trauma. Yeah.
Where are we with it today?
Yeah. So, the reason we've been focusing so much on codependency is it's an offshoot of addictions, and in most cases, people who struggle with addictions also struggle with codependency. We've talked a lot about in the past of what codependency is. Briefly, we'll say it's a disease of lost selfhood. What that means is we just talked for a moment about coming into the world as our loving, authentic, true selves. And so what happens? Why do we then lose those parts of ourselves? If we come in with all of these great qualities, what happens between birth and adulthood that causes us to go astray, causes us to feel disconnected with ourselves and with others, and causes us to feel shame, causes us to feel pain, emotional pain, and whatever that is, which is usually has to do with the way we were parented, as well as what has transpired in our society, and so our culture, the values that our culture prescribes, as well as the way that we're treated. Of course, we have other considerations when we go to school, how our classmates treat us. But it's not just that, because we all have awareness that people who can be treated the same don't turn out the same. So it isn't just what happens to us, it's how we choose to cope with it. And that's our unique selves. So there is in the work of stress and stress management, we know that there's the stressor, and the stressor is something that is happening outside of us. Let's say our parent is yelling at us, that's a stressor. Our teacher is putting a lot of pressure on us to study more. People are prejudiced against us because of the color of our skin or our religion or some other reason. They think that we don't fit in. So these are all stressors, and there's so many of them I can't name them. But then there's our unique personality, which is how we choose to deal with what happens.
So what I'm hearing is we're kind of leaning towards what is known as how do we develop defenses, and then how do we, go by using those defenses?
Yes. The defenses against the loss of our true selves. Right. So people, I'm not going to get into defenses per se today, but it's a good word to use, because we need to defend ourselves if we feel threatened.
Right.
And the threat is certainly as a baby and as a young child, it feels as though it's life-threatening because we're so dependent. So if our parent is angry with us, that's very dangerous for us when we're very young. And so we have to be very careful how we treat our young children, because they're very, very sensitive. And as a human being, we automatically are aware of other people's body language, facial expression, and voice tone. In fact, that's all we know when we're very little. We don't understand the words up until maybe about 6-8 months. That's all we have. And then we start understanding some of the words. By 2, we have a lot of the words down, but we still are very sensitive to the way that the words are said. So, but our stress reactivity is our own unique self. And Our goal as therapists is to help people move from what we would call a victim mentality, where I am the victim of everything around me, to a creator mentality, where I am the creator of everything around me.
Which is actually the latter is true, right? We create everything about ourselves and for ourselves.
We do.
But we don't recognize, most of the time because of that victim mentality.
Yes. So the majority of people have not moved from victim mentality into creator mentality, and they believe that it's only the things outside of them that are responsible for the way that their life is going. And they don't realize that the way that they choose to deal with those things is up to them. We talk a lot in therapy about the subconscious. And the subconscious, the name of the book that we're authoring is The Subconscious Runs the Show, which most people don't really believe or understand really what the subconscious is. But the subconscious is the container for all of our experiences, not only what has happened to us, but also how we have chosen to deal with what has happened to us. So if we have chosen to deal with it in a way that makes us happier and the people around us happier, then our subconscious is working in our best interest and in everyone else's best interest. If our subconscious has chosen to deal with it in a way that just makes us happier, but the people around us unhappy, then our subconscious is sabotaging other people, and we may feel okay, but the people around us don't. And so that's basically where we are, and what we're going to be talking about today is that exact thing, is about how we may feel okay, but the people around us we make miserable.
Right.
Yeah, and that's one of our defenses against the loss of our true selves, and we call that defense projective identification. Projective identification simply means that I am not going to take responsibility for anything that is going wrong in my life that I have created. I'm going to project that out onto somebody else.
Well, we have talked about also before that negative emotions have only 3 places to go to.
Yes.
Right.
Yes.
So then projective identification is actually one of them.
Well, negative emotions go into one of 3 places, or 2 of 3 places, or 3 of 3 places. And we will, when we come back from our break, we will talk a little bit about what happens to those negative emotions, and how what you said is true, how projective identification is where one of those where some of those negative feelings can go to that affect other people.
Perfect.
So
we'll see you shortly in a few seconds after our commercial break.
See you soon.
See you.
Every Friday from 9 to 10 a.m. See you there.
Welcome back from our commercial break. Dr. Mitra and Dr. Robert here at Heart-2-Heart, a program at KMET 1490 AM ABC News Radio. If you're just tuning in, our topic today is codependency, addictions, trauma, impacting relationships, and impacting our true, authentic, loving self, and how to overcome all that. And please call us 951-922-3532, and don't forget that we have a free 15-minute consultation to our 4th caller today. So 951-922-3532, Dr. Robert.
Indeed. So where we left off is negative emotions and positive emotions. Okay, so
projective identification.
Projective identification. Yeah. What I was just thinking of is that there was a book written in the last century, right? In before the year 2000. I think it was written in the 1970s. It was called Anatomy of an Illness.
I have heard about that.
Yes, Anatomy of an Illness, and the doctor who wrote it, his name was Norman Cousins. It's a great book, still available, I believe. And in that book, Dr. Cousins talked about how he was researching how negative emotions affect the body. And it wasn't just him researching it. There was a lot of research going on. It's still going on. And what they discovered was that negative emotions affect the body in a number of ways. And one of the ways, and one of the important ways that negative emotions affect the body is that it lowers the immune system.
Exactly.
Now, there are cancer cells that are within everybody. Everybody carries cancer cells. However, our immune system fights them, and so we don't all develop cancer. However, when your immune system is lowered, you're open to cancer and other opportunistic infections.
Such as COVID-19.
Such as COVID-19, exactly. So what he reasoned was that, and so actually what happened was Dr. Cousins himself developed cancer. And so he started doing the standard at that time, cancer treatments. He started doing chemotherapy, radiation, and then he realized that not only the chemo and the radiation were killing the positive cells, but it was also serving to lower his own immune system. So he decided that he was going to stop the standard treatments. And he reasoned that if negative emotions can lower the immune system, then positive emotions could possibly increase the immune system and fight off the cancer. So what he did was he went out and he rented all of these old comedy films. For those of you who are a little older, you will remember Laurel and Hardy and the Three Stooges. They may even have them on some of the stations today. He just loved those comedians, George Burns, all the different comedic shows. And he sort of stayed in his room and he watched the films, and he just laughed. And all of his doctors were begging him not to disregard the traditional methods for cancer recovery, but he did. And they all had a very short life prognosis for him if he discontinued. But it turned out he fooled them all, and he actually did recover that way. And of course, nobody believed that that's what it was. They didn't know what it was, but they didn't believe that. But it was actually he laughed himself into health, and that's what the book is about. It's called Anatomy of an Illness. And so we now know, fast forward to 2020, we now know that positive emotions definitely create stronger immune systems. And we now know that negative emotions definitely lower the immune system. Now, that's not to say that this is ubiquitous and that everybody who has negative emotions is going to get sick.
Exactly.
Where we left off before the break was we were saying that negative emotions get dealt with in one of three ways. One way is what we just talked about, is it affects our immune system. And it can affect different areas of our body. So one person may have a weakness in the stomach, so they develop stomach problems. Another person may have a weakness in their shoulders or neck, so they have those problems. Migraine headache. Yeah, these are all individual things with individual people, but a lot of it has to do with negative emotions. That's one way that the negative emotions get dealt with is through the body. The second way that negative emotions get dealt with is through self-sabotage. So people people who often, let's say, lose their keys, right? Or people who forget to make an important phone call. And I'm not saying they don't forget, you actually forget. Or people who are constantly getting into accidents. This is self-sabotage. This is the subconscious expressing the negative emotion in a way that's hurtful to the individual.
Or even sometimes I think people who are known as workaholic, due to that extreme level of attention and devotion to working hours, they hurt themselves because they don't allow their brain and their body to kind of ease down, to recuperate, to kind of relax a little bit before they go back to work. So constant working the way they do is actually works against them instead of for them.
Well, yeah, and since you use the term workaholic, what you're basically saying is it's an addiction.
Yes.
And it is.
It is. Yeah.
Addiction being anything that you use consistently to keep yourself in a different feeling state than your normal feeling state, and then that begs the question of why do you need to feel differently, right? And the reason you need to feel differently is because you're not normally connected with your loving, authentic, true self. You're not normally happy, so you may feel bored, you may feel listless, you may feel upset, worrying, angry, shameful, all of these feelings. So you use the addiction in a way to change your feeling state, and it works. It changes your feeling state. But the problem, of course, is that it works temporarily while you're using the addiction, and then you have to keep using the addiction over and over again, which then affects the rest of your life. So workaholics often have difficulties in their intimate relationships, right? Because they're not putting any energy into it. They feel the best when they're working, and they feel and that takes them into an altered state. Not the same. It's not a euphoric state, but it's an altered state where they don't have to feel the feelings that their subconscious is producing.
Exactly.
Yeah.
Yeah.
And so that's two of the three. The first is against your body. The second is self-sabotage. And the third is what we started to talk about, is projective identification, where we take the negative feelings that we're carrying inside of us and we tell other people that they are those feelings. So people who are often attacking other people and thinking that other people are bad, thinking that other people need to be punished, thinking that they're horrible. These are people who have a lot of negative emotions in their subconscious that they don't want to feel, so they put them on other people, and that's what we call projective identification.
And I do have some of those clients. It becomes for them, when they are in a mood of projecting, it becomes all or nothing kind of a concept for them. For example, a husband may suddenly trash his wife and say, oh, she is so worthless, oh, she is so dumb, excuse my language, or because she missed seeing the point that I saw through my own lens. How come, if I could see this point, why is she not able to see it from my point of view?
Right.
And then they say, oh, my wife, is not worth it, and she is not smart, she's not intelligent, she's not capable, she needs to be out of my life.
Mm-hmm.
Within a split of a second.
Right.
Yeah.
Yeah. Yeah. Exactly.
Yeah.
Exactly. So what you're talking about is the black and white thinking style of some people who are all bad or all good.
Right.
Right. And when they actually feel that way. So we do have people that come into therapy who are still looking at the world through black and white lenses, which has to do with abuse, usually in childhood, and the abuse usually keeps them from growing emotionally. So they still see things as a child see things. I don't know if you can remember being a young child, but when we do see things in black and white.
Right.
I remember when I was a kid watching I Spy with Robert Culp and Bill Cosby. and they were the good guys. They were the American agents, secret agents, and Robert Culp played a professional tennis player that took him all around the world, and Bill Cosby was his trainer, but they were secretly spies. And
I
they,
vaguely remember that.
yeah, well,
Yes.
it was a little late for you,
Yeah.
but I remember it,
Yeah.
and I remember thinking, oh, how great America is, and how great democracy was, and how horrible the other side was, you know.
Good old days.
Yeah, the good old days when I could see things so simply, you know, and I was like, yeah, America, America, you know. And then as I grew up, of course, I realized, you know, that we are, you know, we're not always in the right, you know. And so, yeah, it's seeing things in black and white. So we're talking today about projective identification, which is very, very common in the world, and very common amongst people who are codependent and can't really self-reflect. They can't look at what they're doing to create something. So they want to see themselves as all good and other people as all bad. Now, again, a lot of this comes from childhood abuse. And the way, of course, we're talking not just that it's the abuse, but it's the way that the person coped with the abuse. It's not just that the fact that we got abused, because there are people who get abused and they cope with it in ways that are positive for themselves and positive for others. But some people, and a lot of people, can't. A lot of people hold it in and then use it to hurt themselves and or to hurt others. And so if, let's say, you have a lot of subconscious anger because you were treated unfairly as a child over and over and over and over again, or that you were physically or emotionally beat up, you know, called names, called stupid, called a moron, slapped across the face, hit with a belt, that kind of thing. So then you were battered.
Or given negative beliefs about yourself.
Right. So let's say let's say Dick is the guy who was beat up and battered, and so all he learned when he was young was that, and this was by his father. So he identified with his father, and his father was very angry, and so his father not only took the anger out on him, but also was a role model for him of how to be in the world as an angry man. So Dick grew up and he's very angry, but Dick is also bright, so he learned that if he gets angry with other people, he may not be so well liked or so popular. So what he then does is he projects his anger onto other people. So Dick then projects his anger onto Jane. What does that mean? It means he doesn't fully feel or experience his own anger, but he entices Jane to get angry for him. So he does things to Jane to make her angry. And then when she gets angry, then he can go, wow, you're really out of control. You're really angry, not realizing that he was the one who was enticing her to do that. If a person is having a lot of shame, then that can be projected onto other people. If you have people working for you, or if you're married, you can project that onto other people. So instead of helping or supporting others, you can then shame them.
Mm-hmm.
And then the person walks away feeling as though there's something wrong with them.
Yeah, how could you miss this point? How could you not see that dot? How could you not see that comma?
Right.
How could you not see that penny?
Right.
They go through precise little things that majority of people don't care for.
What's wrong with you?
What's wrong
with you?
Right.
What's wrong with you? This is so clear. This is so obvious.
Yeah, you're so dumb. You will never get it. No matter how many times I remind you, you will never get it.
Exactly.
Yeah. Shaming, more shame, more guilt, more fear. And then they are on the pedestal themselves.
Exactly.
Right?
Exactly.
Yeah.
Yeah. Looks like
Exactly.
we have some pounding in the back.
We have some pounding in the back, and I
Yeah.
don't know where that's coming from.
Yeah, I think it's
So we apologize for that.
Yep.
You know.
Anyway, when we come back, we're going to talk more about this. And remember that if you call us, if you're the fourth caller, you will receive a free 15-minute consultation on any topic of your choice. It can be something personal or something that we're talking about on the air. And we want you to continue to call us. Our number is 951-922-3532. Fourth caller, free 15-minute consultation. We'll see you after the break.
Yes. Welcome back to our commercial. Dr. Mitra and Dr. Robert here at Heart-2-Heart program at KMET 1490 AM ABC News Radio with the topic on projective identification as part of codependency and as part of trauma addictions and impacting our relationships. And don't forget, you need to be the number 4 caller so you can get your 15 minutes consultation with either one of us. Call us, please, 951-922-3532. Dr. Robert.
Yes.
Projective identification.
So, yeah. So in this segment of the program, we're going to talk a little bit about the healing process.
Okay.
And projective identification, once more, means that we are disowning the negative parts of ourselves, the negative feelings inside of ourselves, the shame, the anger, the pain that we experienced early on. We project it onto other people, and we make them the carriers of it. And
I like the term disowning that part of ourselves.
Yes.
You know,
mm-hmm.
And to disown it, you know, one needs first to recognize that they're doing that.
Well, yeah, and so that goes to the idea of, guess what? We didn't have perfect parents.
Mm-hmm.
Mm-hmm. And so in all addictions, including codependence, which is really the biggest form of addiction, and it's the most widespread form of addiction, because most people have no idea that they are codependent, and so they don't do anything about it. And they don't realize that it causes a lot of pain within them and within their relationships. So the whole idea of recognizing that you are codependent has to do with denial, and that's the biggest obstacle in all addictions. So if you're an alcoholic, if you use meth, if you use cocaine, if you use heroin, if you use alcohol, if you use any kind of prescription pills that are euphoric, those are obvious addictions. And often, I'm not going to say 100% of the time, but very, very high percentage of the time, the reason we have the addiction is because we are denying the internal pain that we experienced as when we were young.
Mm-hmm.
And we cannot recover until first we are aware that we have the addiction or we are codependent. And in order to do that, we have to dispel the denial, which means opening up the proverbial can of worms and looking at what happened in our childhood and how it affected us. And most people either minimize what happened to them or deny it totally. So,
and some people even say, you know, why would I want to go back to a hurtful place?
Right. And of course, opening that can of worms needs to be done carefully.
Right.
And that's why, a trained therapist who knows how to do it, millimeter by millimeter, so that each piece can be slowly looked at and digested, is necessary, because if you try to open it up, and some people do that, they try to go to seminars and they get open way up wide, and they walk away kind of raw, and then they go, wow, that was powerful, but I guess I'm healed now, not realizing that it takes a long time to understand and to integrate everything that comes up for you. If you did have some sort of childhood abuse.
Exactly. It's sort of like having a mental surgery. When people have a surgery, they don't just go to the hospital, to the operating room, get the procedure done, suture up, come to the recovery, and go home and go to work.
Right.
It's not going to happen that way.
Right.
You know, usually
Right.
post-surgery, it's a much more important part of, care that a person needs to give to themselves, right?
Yes.
It's the same thing. I mean, we can't just open a can of worms and identify what's going on and say, okay, I'm cured. No.
Right.
The process of that is the most important part of it.
Right. So what I want to say, because I said this segment is going to be about healing, in order to heal, we have to realize that we need to heal from something. And that means moving out of denial. And what is it that we're in denial of? Usually we're in denial because we are protecting our parents from feeling negative feelings toward them. And if I've heard it once, I've heard it 10 million times. My parents did the best they could.
Yes.
Right? And when people say my parents did the best they could, the subtext of that is, I don't want to look at anything that they did that was hurtful to me, because that would be disloyal to them. And that loyalty to the parents is the major issue. And what we have learned in psychotherapy is that the more loyal you are to the parent, usually the more injury you're carrying, because there's a lot of pain that you feel, and you don't want to be disloyal to your parent, usually because you know that maybe your parent did do the best they could, but doing the best that you can doesn't excuse or justify the negative things that happen to you. All it does is put it on the shelf so that you can examine it. And this is not, and psychotherapy is not about bashing the parent. I'm a parent, now I'm a grandparent, and I know I didn't do a perfect job. And my daughter has been in therapy quite a bit, and I know I'm the subject of some of that. And I'm glad that she's able to look at it. And then when she does, she's able to come to me and talk to me about it. But that doesn't mean that everybody who goes into therapy who talks about their parents will be able to discuss it with their parents. But the person themselves, when they realize that negative things have happened to them and that they are still carrying the wounds from those things, then they can begin to heal from it.
Exactly.
So the denial that your parents did anything that was hurtful to you is the major barrier. And the more and so how do you heal from that? And the first step is recognizing that your parents were human, and that even if your parents did do the best that they could, and I believe that most parents do the best that they can with the knowledge that they have
and the abilities that they have,
it still doesn't negate the fact that they've injured you, and that injury is still affecting you. So the recognition that your parents were imperfect and your parents injured you is the biggest step in healing. And once you recognize that, guess what feelings are going to come up? You're going to feel very, very sad. And you're also going to feel angry, because those are the feelings that you've repressed in order to justify that your parents were okay and that what they did was okay. So what does unfelt or unexpressed anger and unfelt or unexpressed sadness do? It means that we then have to grieve. We have to grieve over the fact that we didn't get what we needed, or we got what we didn't need. We got negatives from our parents. Perhaps we got we weren't honored or respected as we needed to be by our parents. Perhaps we were talked down to. Perhaps, and our parent may have loved us and did the best they could, but these things happen nonetheless. And so we have to be aware of it so that we can begin to grieve it. And as we grieve it, the goal of all grieving is to get to a place of acceptance. And so when we accept what has happened, and we have let go of most all of the negative feelings that we have, then the healing process is taking place.
Right.
So the first step is the recognition that we were injured, and the second step is the grieving. And then along with the grieving goes what we would call original pain work, which means looking at how we were injured and how that affected our view of ourselves and our view of others.
Exactly.
Yes.
Right.
And so those are the three basic steps that you need to take if you have been injured. And the best way to do that I know is to find a therapist who is skilled in working with addiction and with core issues and codependency. And of course, reading about it is a great way to start.
Exactly.
Yeah.
Yes.
And the book that I keep recommending is this older book called Codependence: Healing the Human Condition, and it's by Charles Whitfield. And you can pick up that book through Amazon. But I also think that as you read it, you may start to feel overwhelmed. So you need to read very, very slowly and be aware that this is going to bring up feelings for you.
Right.
Yeah.
And then, one of the things that I have noticed among this group of people, which is lots of us are like that, is that they actually, for a surviving mechanism, they adapt into their parental behavior, right? And then they assume those roles as they grow up, so they are become a representative of their parent, their mom, their dad. Like if somebody's father, for example, being a person that continue to accuse everybody of wrongdoing and put himself on the pedestal as the person who's always right, it's normal to see that the younger, the younger adult of usually the sons, to behave that way.
Right.
That they think that they are right, that they think that they are the victim, and they think that everybody around them is wrong, and they give themselves permission to correct them all the time, or to point at things that they didn't go in a way that they wanted to go, or they assume that everybody must know, how things needs to be done their way.
Yes.
Right.
Yes.
And so when we point out that they have actually adapted the behavior that they have witnessed, with their father and among themselves, and how they managed to survive those behavior is by accepting the parental behavior as a way of life for themselves.
Yes.
They say, oh, I'm nothing like my dad, or I'm not anything like my mom.
Right.
But and then it's amazing that during adulthood, this group of people, they have such a tremendous love for their parents.
Yes.
They actually, put it in their will. They say, oh, that my wife or somebody else is responsible to take care of my mom after I'm gone. They're responsible to take care of my dad after I'm gone.
Yes.
They put money aside for that. It's just, they do such a caring things for their parents to make sure that they are safe, they are healthy, and that they have everything that they need, right? And then, but in therapy, you can see how much anger they have towards these parents, but in real life, they do the exact opposite.
Exactly. Yeah, very good point. Yeah, excellent. And so what I'm going to say then is that being able to see your parent as a flawed human being is essential for recovery from most addictions and from codependency. Recognizing their flaws as well as their good points.
Right.
Because the flip side of what you said, and what you said is totally accurate, that people subconsciously imitate their parents. They say imitation is the greatest form of flattery, right? So you're imitating them because you've looked up to them and because you see them as role models. The flip side of that is often people will do the opposite. And so if our parents were very angry, then we may never get angry, right? And so we see anger as a bad thing.
Well, I'm one of them.
And then
people tell me you never get angry.
Yeah. And then that anger that we don't allow ourselves to get then hurts us because we hold it in.
Right.
And sometimes we do it with other people in a passive aggressive way. We take it out on the other person without recognizing that we're angry and we're doing things to hurt them.
Exactly.
Yeah.
Yes. And then we are at the end of our program, but I'd like in our next program to talk about the shame and the guilt that comes with recognizing that our parents actually can be flawed.
Right. So, before we close, I simply want to reiterate that these are all aspects of loss of our authentic, true, loving selves, and that can be healed. But it can only be healed when we look honestly at what happened to us, and we don't make excuses for our parents, and we say they made mistakes. And I can only be better if I recognize what those mistakes are and I deal with them not just intellectually but emotionally.
Absolutely.
And because the emotions are the part that we carry in our subconscious that then create the issues for us in our lives, both with ourselves and with those we love.
So we are at the end of our program. Don't forget to please join us Thursday at 3 p.m. and on next Friday at 9 a.m. for other episodes of Sexuality and Trauma and Addictions. And until then, don't forget that all you need is love. Thank you for listening to us.
Bye-bye.
Bye-bye.
Views and claims expressed are those of the program producer and are not endorsed by this station. Opinions expressed are not necessarily